The day I was diagnosed with diabetes is a day I will never forget.
When I was diagnosed, I was just 15. I was like a teenage girl. I wanted to go out with my friends, enjoy life and explore and expand. And diabetes made life very limiting.
Since I was initially diagnosed, my life changed radically. My parents were shocked and they decided to hide it from my relatives and friends.
I knew nothing about diabetes, didn't know what was happening in my body. Why am I feeling like this? Why am I not well?
Diabetes was something that I knew of and ran within my family, but it was something that was a big change for me. And I think I took it seriously for a short time, and then it just kind of went up and down over time.
Definitely felt embarrassed by diabetes. I'd say in that age range of sort of teens, definitely, that was the hardest part because it was a fear of being different and I always wanted to be the same and I wouldn't want people to know about it.
Eu senti que era desafio diário, desafio para ser aceite.
Living with diabetes can be a challenge, you know, thinking about it all the time and it's always in the back of your mind.
Diabetes is almost like a permanent newborn where you constantly have to give it attention. You don't get a break from it, it's 24/7. So you're constantly thinking about what actions and things would impact your sugar levels and how that would make you feel.
Diabetes changed my life totally because I had to change my eating habits, the way I eat and when I eat.
We are all aware about the 5 pillars of diabetes management, being medicine, meal planning, monitoring, and movement. And the 5th one, which is the most undermined, is mental health.
Living with diabetic complications has changed my life altogether, which is not an easy. I am always in a fear to travel alone.
I think for healthcare providers, there's too much to talk about. And so when you see a healthcare provider, they're really monitoring your numbers.
É muito importante a família estar presente, é muito importante a família aceitar. E são os primeiros a quem nós recorremos, nós que temos diabetes, a quem nós recorremos a pedir ajuda, a pedir apoio, abraço.
In 23 years of living with type 1 diabetes, never was I screened or never have I seen anyone being screened for diabetes distress or burnout.
Having all my family and my friends around me that have always been supportive and always helped whenever I've needed it, whatever it might be, it really helps. And
I developed eating disorders a few years after my diagnosis. I got very confused and frustrated, so I went on the internet hoping to find some answers. And that's when I realized that there's not much information available in my own country, and I wish it could have been different.
I think what it is about dealing with this disease is that it takes a lot of support. The people who support you, who you can talk to, who you can learn from. This is peer-oriented, really makes a huge difference.
Diabetes care improved my life a lot. At first time, I was not aware of about a healthy life, but after coming under the treatment as a type 1 diabetes, I got counseling and education, health education, diet education, and motivation for a quality life.
Well, first of all, I'm so proud to say that I have reached 68 years old and I'm feeling wonderful. Women of my age face a lot of challenges. The first one is the physical and the mental complications. You know, aging brings health issues, chronic illnesses, and sometimes cognitive decline. We are so prone to arthritis, hypertension, diabetes, cardiovascular diseases, and the foundation of all of those chronic conditions is healthy eating and physical activity.
Es un proyecto, pero es un proyecto, es un armado. Es, bueno, hoy me voy a cuidar más que ayer. Hoy voy a tratar de caminar más que ayer.
But having a physical exercise routine makes me more healthy by improving my overall health condition. It helps me to lower my blood glucose, helps me to reduce the chance of having cardiovascular conditions or renal impairment.
Access to diabetes care has given me absolute freedom to live my life and to be as healthy as possible for as long as possible, so that I can just have as much time here looking after this little one and watching her grow up.
I think for me, I'd put on a lot of weight. So I think just being able to lose a lot of weight has just given me that energy back so I can keep up with my young kids.